I will present the ARDS network trial on tidal volumes. This study compares lower versus traditional ventilation strategies. Mortality for ARDS is high, at 40 to 50%. Animal studies show that large tidal volumes cause inflammation and injury. Previous trials were conflicting. It remained unclear if lower tidal volumes could actually improve clinical outcomes. The objective was to determine if lower tidal volumes improve outcomes for patients with acute lung injury, or ARDS. This multi-center RCT involved 10 university centers. 861 patients were enrolled between 1996 and 1999. Inclusion required low PaO2 ratios and infiltrates. Exclusion criteria included pregnancy and chronic liver disease. We compared 12 milliliters versus 6 milliliters per kilogram. Outcomes included mortality and ventilator-free days up to day 28. We used students' t-tests and Wilcoxon tests. The trial was stopped early due to a significant mortality difference. Groups had similar baseline characteristics. Minute ventilation was slightly higher in the lower tidal volume group. Separation in tidal volume and plateau pressure was achieved. The lower volume group had higher PaCO2 and lower pH. Mortality was 31.0% versus 39.8%. The lower tidal volume group had significantly more ventilator-free days. Survival curves show a clear benefit starting early. These results are consistent with the observed mortality reduction. The mortality benefit was consistent across all levels of lung compliance. The benefit does not depend on baseline status. Lower tidal volumes reduced mortality by 22%. Plasma IL-6 levels also decreased, indicating less inflammation. Results align with animal models of epithelial injury. Reduced IL-6 supports a reduction in systemic biotrauma. This study had more power and larger separation than prior trials. This likely explains the definitive clinical results. The trial was open-label and used specific acidosis management. Comparing ventilator days among survivors can be complex. Ventilation with 6 milliliters per kilogram decreased mortality in ARDS. Limiting lung stretch should be a high clinical priority. This research was published in NEJM in 2000. Thank you for listening, and I am happy to answer any questions.